Fibrillation is when we shock the heart back into rhythm, like when you see them use paddles and gel on television. Fortunately, we now have devices called ICDs, or implantable cardiac defibrillators, which can shock the heart out of dangerous or deadly fast heart rhythms back into normal rhythm. The devices work all on their own. You don't need to be in a hospital, around medical personnel, or even around any other people at all. An ICD is a relatively small computer and a battery wrapped in a metal can. It's inserted under the skin, but outside the chest cavity, and has one or more wires that connect it, via the veins, to various chambers in the heart. The wires allow the ICD to sense or see what the heart rhythm is doing, as well as pace the heart to increase its rate if needed, or it can shock the heart into rhythm when needed. A typical ICD initial implant involves bringing you into the hospital, where in the EP lab we give you some medication to sedate you. You typically aren't completely under or on a breathing machine. Rather, we make you sleepy and comfortable so that you won't feel or remember anything. Then, we numb the skin and the area where the ICD goes on the chest. We make a small incision, and through that incision, place one or more wires into the vein. Via that vein, we pass the wire or wires down into the heart. The other ends of the wires are then connected to the ICD, and the ICD tucked in under the skin and closed up with stitches that will self-absorb. We typically keep you in the hospital overnight, and if all goes well with some testing the next morning, you are usually discharged to home. You will have instructions before leaving the hospital on the do's and don'ts, including how to care for the incision and limitations on lifting and moving the arm on the side of the ICD. Once implanted, we typically follow or check ICDs every 3 months or so. However, you do not have to travel to our office for that. Fortunately, this can usually be done from the comfort of your own home using a monitor, which we will provide to you often before you leave the hospital. ICDs have batteries, and as such, the batteries eventually run low. They typically last several years, depending on how much they're being used. However, it's not like the battery in your TV remote in that it just suddenly stops working. Rather, the ICD actually alerts us when the battery is nearing time to change. And then we have several weeks to arrange for that to be done. When the time comes to change it, we technically don't just change the battery. We change the battery and the computer unit, what we call the generator. But the wires do not need to be changed. Thus, you usually go home the same day as that procedure. We will discuss the risks and benefits of your initial ICD implant in more detail in person. But briefly, the issues we're concerned with at implant include infection, bleeding at the site in the chest or around the heart, as well as collapsed lung.